sa Teichner.
The outbreak is growing. More deaths, more cases as thousands of Americans begin to self-quarantine.
Washington State's death toll continues to rise.
In this time of pandemic due to COVID-19 has ultimately brought us into a devastating life. Many had suffered, had starved, and lost their sources of income. Our state of economy suddenly diminished and it is hard to recover what we have lost. So ano nga ba ang meron sa COVID-19 na ito? Paano at kailan ito nagsimula?
What is coronavirus? Coronaviruses are a large family of zoonotic viruses that cause illness ranging from the common cold to severe respiratory diseases. Zoonotic means these viruses are able to be transmitted from animals to humans. There are several coronaviruses known to be circulating in different animal populations that have not yet infected humans. COVID-19 is the most recent to make the jump to human infection. Common signs of COVID-19 infection are similar to the common cold and include respiratory symptoms such as dry cough, fever, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and death. The COVID-19 infection is spread from one person to others via droplets produced from the respiratory system of infected people, often during coughing or sneezing. According to current data, time from exposure to onset of symptoms is usually between 2 and 14 days, with an average of 5 days. Moving on to the recent coronavirus outbreak history. Before, 2 other recent coronavirus outbreaks have been experienced. Middle East Respiratory Syndrome or MERS-CoV of 2012 was found to transmit from dromedary camel to humans. In 2002, Severe Acute Respiratory Syndrome or SARS-CoV was found to transmit from civet cats to humans. Although COVID-19 has already shown some similarities to recent coronavirus outbreaks, there are differences and we will learn much more as we deal with this one. SARS cases totaled 8,098 with a fatality rate of 11% as reported in 17 countries, with the majority of cases occurring in the southern mainland China and Hong Kong. The fatality rate was highly dependent on the age of the patient, with those under 24 least likely to die, which is 1%, and those over 65 most likely to die, which is 55%. No cases have been reported worldwide since 2004. According to the World Health Organization, or WHO, as of 2020, MERS cases total more than 2,500 have been reported in 21 countries and resulted in about 860 deaths. The fatality rate may be much lower as those with mild symptoms are most likely undiagnosed. Only 2 cases have been confirmed in the United States, but in May of 2014, and both patients had recently traveled to Saudi Arabia. Most cases have occurred in the Arabian Peninsula. It is still unclear how the virus is transmitted from camels to humans. Its spread is uncommon outside of hospitals. Thus, its risk to the global population is currently deemed to be fairly low. From this information given, where did coronavirus started? On December 31, 2019, China reported to the World Health Organization or WHO cases of pneumonia in Wuhan, Hubei province of China, caused by a novel coronavirus currently designated 2019 nCoV. Mounting cases and deaths pose major public health and governance challenges. China's imposition of an unprecedented cordon sanitaire or a guarded area preventing anyone from leaving in Hubei province has also sparked controversy concerning its implementation and effectiveness. Cases have now spread to at least 4 continents. As of January 28, there are more than 4,500 confirmed cases or 98% in China, and more than 100 deaths last year. China rapidly isolated the novel coronavirus on January 7 and shared viral genome data with the international community 3 days later. Since that time, China has reported increasing numbers of cases and deaths, partly attributable to wider diagnostic testing as awareness of the outbreak grows. Health officials have identified evidence of transmission along a chain of 4 generations. A person who originally contracted the virus from a non-human source infected someone else, who infected another individual, who then infected another individual, suggesting sustained human-to-human transmission. Current estimates are that 2019 nCoV has an incubation period of 2 to 14 days, with potential asymptomatic transmission. Multiple countries have confirmed travel-associated cases, including Australia, Cambodia, Canada, France, Germany, Japan, Nepal, Singapore, South Korea, Taiwan, Thailand, United Arab Emirates, United States, and Vietnam. Vietnam identified the first human-to-human transmissions outside China, yet fundamental knowledge gaps exist on how to accurately characterize the risk, including confirmation of the zoonotic source, efficiency of transmission, precise clinical symptoms, and the range of disease severity and case fatalities. While in the Philippines, the first suspected case in the Philippines was investigated on January 22, 2020, and 633 suspected cases were reported as of March 1. We describe the clinical and epidemiological aspects of the first 2 confirmed COVID-19 cases in the Philippines, both admitted to the National Infectious Disease Referral Hospital in Manila. Both patients were previously healthy Chinese nationals on vacation in the Philippines, traveling as a couple during January 2020. Patient 1, a 39-year-old female, had symptoms of cough and sore throat and was admitted to San Lazaro Hospital in Manila on January 25. Physical examination was unremarkable. Influenza B human coronavirus 229E, Staphylococcus aureus and Klebsiella pneumonia were detected by PCR on initial nasopharyngeal or oropharyngeal NPS-OPS swabs. On January 30, SARS-CoV-2 viral RNA was reported to be detected by PCR on the initial swabs, and she was identified as the first confirmed COVID-19 case in the Philippines. Her symptoms resolved and she was discharged, while patient 2, a 44-year-old male, had symptoms of fever, cough, and chills. Influenza B and Streptococcus pneumonia were detected by PCR on initial NPS-OPS swabs. He was treated for community-acquired pneumonia with intravenous antibiotics. But his condition deteriorated and he required intubation. On January 31, SARS-CoV-2 viral RNA was reported to be detected by PCR on the initial swabs, and he was identified as the second confirmed COVID-19 infection in the Philippines. On February 1, the patient's condition deteriorated, and following a cardiac arrest, it was not possible to revive him. He was thus confirmed as the first COVID-19 death outside of China. The Philippines confirmed 3,276 new cases of COVID-19 on Sunday, bringing the country's total to 591,412. This marked the third straight day of more than 3,000 cases, the first time it happened since September 18 to 20 last year. The Department of Health also reported 10,516 new recoveries, pushing the total number of Filipinos who recovered from the disease to 545,853. This meant that the country has a total of 36,043 active cases as of 4 p.m. Sunday. 51 more deaths were reported from the illness, bringing COVID-19's death toll in the Philippines to 12,560. Several new and more infectious variants of the novel coronavirus have emerged. One variant, which was first reported in the United Kingdom, has spread to the Philippines. The DOH has also confirmed 2 mutations of the SARS-CoV-2, the virus causing COVID-19 in Central Visayas. Another variant is from South Africa, has drawn concern from scientists as vaccines seem to be less effective against it. The Philippine General Hospital, the country's largest COVID-19 referral medical center, said that one of 30 anonymized samples from the facility was found to have the South African variant of the disease. Vaccines typically require years of research and testing before reaching the clinic, but in 2020, scientists embarked on a race to produce safe and effective coronavirus vaccines in record time. Researchers are currently testing 74 vaccines in clinical trials on humans, and 21 have reached the final stages of testing. At least 78 preclinical vaccines are under active investigation in animals. The list of vaccines available in the Philippines are: first, the Pfizer-BioNTech, which is from US, Germany, and approved on January 14, 2021. Second is the Oxford AstraZeneca, which is from UK and approved January 28, 2021. And lastly, the Sinovac vaccine, which is from China, and it was approved on February 22, 2021.
Coronavirus disease 2019, or known as COVID-19, is an infection disease caused by acute respiratory syndrome disease. The disease was identified in 2019 in Wuhan, China, and has since spread globally.
How does the 2019 coronavirus spread? What are the different ways of transmission? Coronavirus is an contagious viral stain that can be passed from one person to another via direct contact, respiratory droplets like sneezing, coughing, or talking, touching a surface infected with the virus. Contact and droplets transmission. Transmission of SARS-CoV-2 can occur through direct, indirect, or close contact with infected people to infected secretion such as saliva and respiratory secretion or the respiratory droplets, which are expelled when an infected person coughs, sneezes, talk, or signs. Respiratory droplets are 5 to 10 in diameter, whereas 5 diameter are referred to as droplet nuclei or aerosol. Respiratory droplets transmission can occur when a person is in close contact with 1 meter with an infected person who has respiratory symptoms, example, coughing or sneezing, or who is talking or singing. In this case, circumstances, respiratory droplets that include virus can reach the mouth, nose, or eyes of a susceptible person and can result in infection. Indirect contact transmission involving contact of a susceptible host with a contaminated object or surfaces may also be possible to transmit the coronavirus of a person to person. Airborne transmission. Research showed that the virus can live in the air for up to 2 hours. It can get into your lungs if someone was breathed out and you breathe that air in. Experts are divided on how often the virus is spread through the air routes and how much it contributes to the pandemic. Other modes of transmission. Person-to-person contact is thought to be the main method of transmission for the SARS-CoV-2 virus, according to the Centers for Disease Control and Prevention, or CDC. Imagine sitting next to someone with a SARS-CoV-2 infection on the bus or in a meeting room. Suddenly, this person sneezes or coughs. If they don't cover their mouth and nose, they could potentially spray you with respiratory droplets from their nose or mouth. The droplets that land on you will likely contain the virus. Or perhaps you meet someone who contracted the virus and they touch their mouth or nose with their hand. When that person shakes your hand, they transfer some of the virus to your hand. If you then touch your mouth or nose without washing your hands first, you may accidentally give that virus an entry point into your own body. Pregnancy and breastfeeding. Medical experts haven't determined whether the woman can transmit SARS-CoV-2 in utero through childbirth or through her breast milk. The CDC currently recommends that the mother with a confirmed case of the virus, as well as those who may have it, are temporarily separated from their newborns. These separations help decrease the risk of transmission. Can someone spread the virus even if they don't have any symptoms? Some experts do believe it possible that someone with a novel coronavirus infection could transmit it to others, even if they don't show any symptoms or have such mild symptoms that they don't really know they're sick. According to the CDC, A person who has contracted the virus is most contagious when they're showing symptoms, and that's when they're the most likely to transmit the virus. But someone may be able to pass on the virus even before they start to show symptoms of the disease itself. The symptoms may take anywhere from 2 to 14 days to show up after exposure to the virus. One recent study of 181 patients with COVID-19 found a median incubation period of about 5 days, with more than 97% showing symptoms by 11.5 days after exposure to the virus. Can you pick it off the coronavirus from infected surfaces? Experts don't know for sure how long the novel coronavirus can survive on these surfaces. But if the virus behaves like others, similar viruses, the survival time could range from several hours to several days. The type of surface, the temperature of the room, and the humidity of the environment may play a role in how long the virus can survive on the surface. How do you know if you have been infected with coronavirus? These are the possible symptoms range from those of the flu to a mild cold, including fever, cough, shortness of breath, breathing difficulties. If you're experiencing any of these symptoms, do not panic. Call your local emergency health service.
Justin had an awesome weekend. Now that it's Monday morning, he's taking the good vibes into the office and surprising his work pals with donuts. Problem is, tasty treats aren't the only thing he's about to share. Justin doesn't know it, but he picked up a germ at a concert last week. Now he's sprinkled his donut box, his hands, and the office door with those germs. In real time, as Justin says good morning to John, and Ashley grabs her favorite Boston cream, those germs have hitched a ride onto two new hosts. With a rub of the eyes and a gulp, they're through the human front door and ready to get down to the business of making people sick. A little later, George comes with the mail. Justin offers him a donut and with a tickle in his throat, turns his head to cough. Justin says bye to George and leaves more germs behind. George starts making his deliveries, and as you can see, there's no return to sender on Justin's leave behind. All it takes is a touch of the germy mail, and then a touch of the mouth, nose, or eyes for a person to become infected. When it's time to call it a day, Ashley brings the infection onto the train. She hasn't washed her hands in hours. The germs covering them make a pit stop on the grab bar before finding a home on some new hands. A few cars over, Justin is coughing again. In these tight quarters, that's bad news. He and his fellow passengers get off the train and head to their homes. The spread continues. But what if Justin's morning had gone more like this? A sneeze into the elbow, and then some hand sanitizer to be safe, a cough into a tissue, and a good job throwing it away and washing hands. Coworkers don't touch their eyes, noses, or mouths, no matter what. By following those steps, Justin's germs could have stayed away and slowed the pace of the spread.
proceed on how to avoid being infected by COVID-19.
T. Magno, and I am here to talk about the importance of being conscious and being aware about the virus COVID-19. We all need information that can be trusted because misinformation and false claims threaten to undermine the success of vaccines and put people's lives at risk. Focusing on awareness of preventive measures. Most of the population exhibited good understanding, especially in relation to social distancing. Covering mouth and nose while coughing or sneezing, avoiding close contact with symptomatic persons who has flu and cough, seeking medical help in case the symptoms prolong after incubation period during quarantine. However, other preventive measures such as washing hands regularly and using hand sanitizers were only recognized by 75% of the population. These two approaches are among the important measures which need to be considered on a daily basis to prevent being infected and contain the spread of the virus. In relation to the reliable sources of information about COVID-19, majority of the population must rely more on the recognized organizations such as WHO, also known as the World Health Organization, and also the healthcare experts. It is important that the public should rely on reliable sources of information, as unreliable sources increase the chances of contamination and other challenges related to healthcare and social challenges as a result of vast misinformation available on various channels. In relation to the types of information to be considered during COVID-19 outbreak, there has been no consensus among the organizations. However, information related to preventive measures, symptoms, and self-care were the most promoted. There is a need for considering the additional information in order to prevent the spread of misinformation, and also to enable people to manage their activities during lockdown or quarantine and manage their lifestyles and other aspects such as finance, basic needs, and other necessary aspects. Therefore, various types of information were reviewed, and 15 different types of information were perceived to be highly important by most of the population. Focusing on the channels or modes of promotion, it is essential to consider that information must be disseminated to a large section of the population within a short time, and it is also essential that regular updates can be easily accessed by the public. Social media and mobile phones, such as SMS or phone calls, can be effective in reaching a large section of the population in a short period of time. Therefore, approaches such as passing messages and information about COVID-19 before connecting a call on mobiles by the mobile services companies and daily SMS and mobile applications launched by the government to create awareness and track diseases and vulnerability of the users having an infection are proving to be effective in different regions. However, majority of the population preferred online government portals and press releases compared to social media platforms. In addition, mobiles and televisions were considered by the participants to be effective platforms for creating awareness. It is interesting to note that newspapers were least preferred compared to other channels, as the risk of contamination may be high. By effectively creating public awareness, the spread of COVID-19 can be minimized and the risk of infections, death, and losses can be prevented. It can also result in effective health outcomes, improved quality of life during lockdowns, survival, and proper planning of work, business, and other finances. Based on these findings, a framework for creating public awareness with components including information sources, types of information, communication channels, and the outcomes is formulated, especially considering everybody's lifestyle. This framework can also be used as conceptual framework for future studies, focusing on evaluating public awareness related to pandemics and infectious diseases. This also analyzed the public awareness about. There is a need for considering the additional information in order to prevent the spread of misinformation, and also to enable people to manage their activities during lockdown or quarantine and manage their lifestyles and other aspects such as finance, basic needs, and other necessary aspects. Therefore, various types of information were reviewed, and 15 different types of information were perceived to be highly important by most of the population. Focusing on the channels or modes of promotion, it is essential to consider that information must be disseminated to a large section of the population within a short time. And it is also essential that regular updates can be easily accessed by the public. Social media and mobile phones, such as SMS or phone calls, can be effective in reaching a large section of the population in a short period of time. Therefore, approaches such as passing messages and information about COVID-19 before connecting a call on mobile by the mobile services companies and daily SMS and mobile applications launched by the government to create awareness and track diseases and vulnerability of the users having an infection are proving to be effective in different regions. However, majority of the population preferred online government portals and press releases compared to social media platforms. In addition, mobiles and televisions were considered by the participants to be effective platforms for creating awareness. It is interesting to note that newspapers were least preferred compared to other channels, as the risk of contamination may be high. By effectively creating public awareness, the spread of COVID-19 can be minimized and the risk of infections, death, and losses can be prevented. It can also result in effective health outcomes, improved quality of life during lockdowns, survival, and proper planning of work, business, and other finances. Based on these findings, a framework for creating public awareness with components including information sources, types of information, communication channels, and the outcomes is formulated, especially considering everybody's lifestyle. This framework can also be used as conceptual framework for future studies, focusing on evaluating public awareness related to pandemics and infectious diseases. This also analyzed the public awareness about COVID-19, its precautionary measures, and its implications on the lifestyles of the people around the world. An online survey was conducted considering the prevailing situation of lockdown to reach maximum participants. A lot of respondents participated in this survey. Overall, the findings revealed that public awareness about COVID-19 varied between moderate to high, and its implications reflected that a few measures were not adopted by the public, such as staying at home, which resulted in an increased number of positive cases of COVID-19. Though they were aware of the precautionary measures of staying at home during lockdowns, most of the population frequently went out of their homes, which might increase the risk of contamination. Therefore, it is very much essential that strict measures and an effective approach for creating awareness are to be adopted. This is to ensure the success of the lockdown strategy in order to limit the spread of COVID-19.
Para labanan ang banta ng COVID-19 sa ating bansa, mahalaga ang kooperasyon ng bawat isa. Ang pananatili sa loob ng bahay ay isa sa pinakasimple pero pinaka-epektibong paraan para hindi kumalat ang virus. Kunwari, ikaw ang tuldok na ito. Malusog ka at malakas. Lumabas ka ng bahay. Ang hindi mo alam, may nakasalamuha ka ng may COVID-19. Tandaan, mahirap malaman kung sinong may virus, pero madali itong maipasa sa iba. Pwedeng naipasa na pala niya ang virus sa iyo nung umubo siya, o bumahin. O baka naman ay nahawa na dahil humawa kayo sa parehong bagay na kontaminado. Ngayon ay mayroon ka na ring COVID-19. Isa ka ng carrier na makakahawa sa iba. Dahil maaaring ilang araw pa bago lumitaw ang sintomas na ubo, sipon, hirap sa paghinga at lagnat. Pwede ring wala kang nararamdamang sintomas, ngunit nakakahawa ka pa rin. Pag-uwi mo sa bahay, maaari mong mahawahan ang iyong pamilya. Kasama na rito ang lolo at lola mo o ang mga magulang mo na may edad. Sila ang may pinakamahina na depensa laban sa virus. Ang mga may sakit sa puso, diabetes, high blood, at iba pang pre-existing conditions at mga buntis, mahina mahina ang panlaban sa COVID-19. Kapag na-infect ang taong mahina ang immune system, posibleng magkaroon siya ng malalang karamdaman at kailanganing dalhin sa ospital. Sa patuloy na paglabas ng bahay at pagpunta sa pampublikong lugar, tinatayang maaari kang makahawa ng 3 pang tao at sila makakahawa ng mas marami pang iba. 20% ng mga nahawa ay maaaring maospital at dadami ng dadami ito habang mas kumakalat pa ang virus. Bukod sa dumaraming COVID-19 patients, marami pang ibang may sakit ang nasa mga pagamutan. Ang mga pasyenteng malubhang-malubha na ang karamdaman, hindi na maaasikaso. Wala ring lugar para sa mga pasyenteng may ibang karamdaman. Kaya nating iwasan ang patuloy na pagkalat ng COVID-19 kung iisipin natin ang kapakanan ng iba. Kailangan nating isipin at kumilos na parang bitbit na natin ang virus para hindi ito kumalat pa sa iba. Sundin ang social distancing. At hanggat maaari, manatili sa loob ng bahay. Kung talagang kinakailangang lumabas, panatilihin ang 1 metrong layo sa ibang tao. Maging malinis din sa katawan at sa kapaligiran. Parating maghugas ng kamay gamit ang sabon at tubig. At i-disinfect ang mga bagay na madalas hinahawakan. Ang mahalaga, mapabagal natin ang pagkalat ng COVID-19 para mas kakaunti ang mga kailangan magpa-ospital at mabawasan ang mga Pilipinong magkakasakit. Magiging epektibo lamang ito kung mananatili tayo sa bahay. Sundin ang social distancing. Isang maliit na sakripisyo para sa buhay ng kapwa nating Pilipino. Tulong-tulong tayo. Let's beat COVID-19.
COVID-19 pandemic has significantly affected us, not only our usual daily routine but also our livelihood and income. Nevertheless, it is essential that we perceive the bright side of our situation. This pandemic helped us to be more responsible and be aware what's happening to our surroundings, specifically in our environment. We build a strong trust and relationship between our families. We are being conscious of the importance of our health. We learn to discipline ourselves, and despite of the challenges, we firmly stand and continue to live. In our Session 1, Assimilate, the history of COVID-19, ways of transmission, how to avoid being infected, and the importance for being conscious of the virus will guide us to have more knowledge and awareness to be serious and responsible in everything we do, primarily if we're going outside. Wear your face mask, wear your face shield. By doing this way, you can stop the spread and you can save lives of many people, especially the healthcare providers who's willing to dedicate their time, effort, and compassion just to save someone's life. Just like Santu said, in the midst of chaos, there is also opportunity. So protect yourselves and others. Be one, and we will do this as one. As Publilius Tyrus said, where there is unity, there is always victory. Stay healthy and safe. Thank you, and God bless us all.